Hi, everyone. Today we're going to speak with Kate Boatright. Oh my God, what a magician she has been in creating a niche for herself in mentorship, both for new grads and for established veterinarians. I think mentorship is the most important piece of continuing education in veterinary medicine. So, Kate is the CEO of Write, WRITE, the boat. You can find her there, but let's hear what Kate has to say now. Hi, I'm Deborah Hamilton. Welcome to my podcast, Why Do Pets Matter? 10 years ago, with my iPhone and a script, I recorded the first episode of the Ultimate Pet Resolution Summit, which chatted with experts about conflicts over animals. Our conversations were intimate, honest, and illustrated how disagreements over animals occur and how those disagreements can reshape people's lives and relationships. In November 2019, I started Why Do Pets Matter, a new podcast that continued these informative discussions. I'm so excited to have you here with me, continuing my exploration into a more meaningful conversation about why pets matter to all of us. My guests and I will share ideas, stories, and experiences straight from the heart, unscripted and holistic. From the bravest moments to the most brokenhearted, we will explore how to resolve disagreements over animals differently. One thing I know for sure is I want to have more meaningful conversations that will help all of us unlock that deeply felt human-animal bond that drives the emotions of conflict. Hi, everyone. It's Deborah Hamilton again, and I am so glad to be here with my friend Kate Boatright of Write the Boat. She has been in the veterinary industry for a number of years and has created a place for herself that helps veterinarians thrive and survive veterinary medicine. So, Kate, thank you so much for coming to Why Do Pets Matter?
Yes, I'm so excited to be here.
Oh, well, I'm excited to have you here. We've been trying to do this for a long time and our schedules
Yeah.
have been so out of whack. So I'm so glad you're here. So tell us a little bit about you and about how you got to write the boat.
Yeah. So I was one of those kids who, from like 5 years old knew I wanted to be a vet. So kind of have always wanted to do this path and was very fortunate to be able to, go to undergrad, straight into vet school. I graduated in 2013 from UPenn. And entering vet school, I wanted to specialize. I was pretty sure I wanted to be a surgeon. And then by about second year, I'm like, I don't know that I want to do like the whole internship residency. Like vet school's hard enough. And I also I couldn't pick one thing that I really liked. I was like, I like surgery, I like neurology, I like emergency. And so I ended up going straight into general practice out of school. And the around the time I graduated, mentorship was a huge conversation piece. And so it was something that I sought out coming out of school. And I was very fortunate to have an amazing mentorship the first year out of school. I left that job after a year because my husband and I were living 3 hours away. And so that was not sustainable for our lives. So I moved across the state. I'm now in Western Pennsylvania and worked at a few different clinics in this area, but I've always been in kind of rural settings. The closest I've ever worked to a specialty hospital is about an hour. And I think, one of the nice things about that is it's given me a lot of opportunity to do things that I may not have if the specialty center was right up the street. But the first clinic I worked at out here in Western PA was not ideal for mentorship. And ultimately, we kind of say like a lot of our experiences, something good can come out of them, even if they weren't a great experience at the time. And that experience really inspired a lot of my interest in supporting mentors and that I've been working on for the past several years. I briefly worked for about 5 years. I worked at a GP and ER clinic. Loved emergency, but the hours, and then I had a kid, and then it was COVID. So I did hit burnout, and was able to work through that. But in that process, I discovered I'd been doing a little bit of speaking and writing on the side, and I realized that I wanted that to be a bigger part of my career. So in 2021, I founded my LLC and I moved to part-time clinical work in a small animal general practice. Still do a little bit of ER urgent care relief, just to get that taste of it. Because I'll admit I sometimes get bored talking about vaccines all day and seeing ear infections. My team actually calls me Captain ER because I get so excited when like the really sick patients come in. I'm like, oh, this is like, yes, let's do this surgery. Let's stabilize this patient. But my two big target areas in the work I do outside of the clinic are mentorship, and really I love working with new grads and vet students. But a lot of the work that I've started to do is really in supporting the mentors and helping them learn how to mentor. Because there's not a lot of opportunity for that. And so making sure that we can give new grads good experiences by supporting the mentors has become my big goal. And then the other thing is spectrum of care and just, educating my fellow veterinarians and team members just about how important it is that we make those connections with clients and that we can really, find the option that works for them and for their pet. And, the two are very closely related because some of the people who need the most support in spectrum of care practice are our new graduates. And so that's kind of my, brief summary of my path to where I am now. And the thread that through it all is I love making connections with other professionals, with parents. That's what fuels me and that's what's kept me in this career despite burnout, despite challenges. I love what I do. And I can't imagine doing anything else.
Well, that's how we met because we are part of a networking group that's fabulous who are in a little bit of mentorship, not necessarily in competition with themselves, because they recognize that there's so much to do. But before we get into that, because I have so many questions that I'm going to throw out just for thought, why do pets matter to you?
Yeah. So, I think for me, I'm one of those people like grew up with pets, like can't remember not having a pet. And from the time I was a kid, I remember seeing the really close bond, especially between my mom and our childhood dog. She was actually my mom's roommate had owned the mother dog. So Buffy, my childhood dog, was literally born on my mom's bed. So she'd been with her from day one. My aunt used to call Buffy Saint Buffy, because she was like the most tolerant dog in the world. Like I learned to walk. She was a long-haired dog, like by pulling myself up on her and toddling around. And she lived to be like 15. So she was a huge part of my early life. And we had several dogs after that. And then we had a golden retriever named Maggie that we got when I was I was actually in my senior year. We brought her home on my mom's last day of radiation therapy from breast cancer, as a puppy. And, my mom says, she's like, I'm thinking like, I'm exhausted. I'm recovering from cancer. Like, why are they giving me a puppy? But, Maggie was a huge part of her recovery and getting back into normal life. Because, she had to take care of her. And Maggie actually came with kennel cough. So she was sick at the beginning. Maggie saw us through my high school graduation and college and vet school graduation, my brother's high school and college graduations, weddings and funerals, and just so many major events in our life. And just having that constant and that love, that unconditional love, And as an adult in my own life, I've been able to have that. We have cats because our little, I miss having a dog, but our cats are basically dog
Dog.
personalities in cat bodies. So they're super sociable and outgoing. And they've been a huge part of supporting through vet school, and into my career. And we're getting to the point now. We're down to one cat, and he's 15 now. And it's hard to be a senior pet parent, and kind of thinking about, okay, what comes next. But just the amount of love and that they give, it's for me, that's what it's all about.
I love hearing that, because the lifetime with a pet, even if you haven't had a pet in a lifetime, and that's okay too, the lifetime with a pet gives you these moments where you think about how they impacted your life by just being there. They matter because they're just there. They just are this silent um entity, living entity, this spirit who lives every day to the fullest. We wish we could live every day to the fullest, and the fullest could be sleeping all day. It doesn't mean they have to be out running, chasing the ball. Whatever works, whatever floats your boat, so to speak, they will do with you, because their biggest day is just to be there for you with what you needed. I loved your story about getting Maggie, right, when your mom
Mhm.
home, because I truly believe that pets keep us from dwelling on things that are not so fun in our lives that
Yeah.
we're going through, and to make sure that we have a different conversation. I had a dog who went home similar to your mother, only it was the beginning, not the end of treatment. It was the beginning of treatment for pancreatic cancer. And the survival rate of pancreatic cancer is like 6 months, I think. He lived
Yeah.
7 years. And I sat there and I said, I don't want to say that it was the dog, but I think it was the dog.
It was the dog.
Because, they changed the conversation. They weren't talking about pancreatic cancer. They were talking about whether or not she peed on the carpet. It's a great thing. So
Mhm.
in doing what you're doing, I love the beginning when you talked about mentorship. It is really interesting to understand that mentors need to be mentored as much as mentees. I always
Mhm.
say, when someone asks me to mentor someone, I say, well, I'm so looking forward to be mentored as well. Tell me a little bit more about whether or not you find generally that mentors are open to being mentored.
So I think there's kind of two categories of mentors. So I think there are the mentors who do it because they have to, because they've got a new grad in and we've got to train them. And that doesn't mean they're a bad mentor. But they may, they're kind of just, they're doing it because this opportunity is in front of them, and they've got this new grad that they need to support. And then you have that group of mentors who mentor just because they love it. And I think those are the ones that absolutely, like, I look at every mentorship as an opportunity to learn just as much as it is for me to teach. I love working with vet students. I had an extern in it's about a month ago now, with us for 2 weeks. I thrive on having people there to teach, but also to learn from, and just to have conversations about, hey, I've been out of school 12 years now. I go to a ton of conferences, I get all my CE, but hey, what are you learning now about, kennel cough? What are you learning now with, the new drugs that are out for, arthritis? Like, how are they teaching that? And so, yeah, for me, it's always just as much of a learning experience as it is teaching.
It's so interesting, because to build a mentorship program, it needs to have someone like you steady at the helm to help people be their best selves in whatever position they're in. Whether they are the new grad coming out with all this new information that they'd love to share with you, but may feel a little intimidated because you're out 12 years and you're this established veterinarian, and you probably know everything, and you wanting to absorb like a sponge what new innovative things they've learned that you weren't there to learn, and how do I suck that out of them as well, because I want to be able to update my practice to make sure that I'm serving both my, intern vets, my associate vets, my clients, with the newest, most efficient, possibly less expensive ways of doing things.
Yeah. Yeah. I mean, and I think like, I think we have that like historical vision of the mentor as I think
What's
like
his name? The
Gandalf or Dumbledore, or like
the
I'm a
guy who
book
did all
fantasy
the
nerd.
dogs great and small. What was his name? That
Yeah, yeah,
from
like you have
Scotland,
that
right?
like that wise,
Yeah.
experienced person, being the mentor. And
Harriet, Dr. Harriet. I knew I remember
yes, James Harriet.
James Harriet.
But I think like, I think mentorship has changed so much. And not only is it that two-way learning, but you have situations where you've got peer mentors. What I, especially for
God,
some of
peer
our more
mentors.
recent,
Nobody even talks about that, Kate. Go ahead.
yeah,
I'm
like,
sorry to interrupt you, but it was like, yes, yes.
yeah, because I mean, especially for our recent graduates who had their schooling affected by COVID, like I cannot relate to that experience. And so I don't know what they lost. I don't,
And they don't know because they
right.
missed it.
Yeah. And so I think this is a key time to have that peer mentorship. As things have shifted so much, be able to talk to other people and learn from them and say, hey, we're not working in the same clinic, but we went to school together. What are you learning at your clinic? What am I learning at my clinic? And having that support. And I think, ultimately it's that connection and that support. And that's what makes this career sustainable. If you're
Yeah.
an island, you're not going to last.
You're going to burn out. Like you said, here
Mhm.
you were running around doing all these things and you just truly burned out. And that's something that's affected veterinary medicine in a big way, both because of the lack of veterinarians, even though we're graduating a lot of them. It turns out that there are a lot more pet owners now than there were before. And
Mhm.
the veterinarians who are graduating these days want to have somewhat of a life above and beyond veterinary medicine. So they're drawing boundaries and there's some pushback. And when you're mentoring someone, how do you help them decide what's their best um, process to maintain their own uh, dignity and self-esteem while also serving either their boss, if they're working for someone, or the client or the staff?
Yeah, and I mean that it's a question I get a lot from mentors. Is like, oh, my new grad doesn't want to work past 5 o'clock, or they want to get out the door. And I'm like, and why is that a bad thing? Like that's my question to them is
Well,
like,
I'm a lawyer, so lawyers are supposed to work until the middle of the night when they get out of law school, which is why I didn't go to a big firm because I said, yeah,
yeah,
no.
yeah, like why is it bad that we want to have that our new grads want to have a life? Like I am so proud when a new grad says, hey, I want to work a 4-day work week. And I think, what I say when I talk to new grads is like, look, there are going to be like, this is a profession where there are going to be days you're going to stay late. I don't think that should be the norm.
Right.
But I think, some
You
of
have to be
it
open to
is,
be flexible when things happen to be a team player. So everybody else doesn't get.
yeah. And it's like, yeah, when yes, it's awful when you get that call at 5:30 and you're closing at 6 and the dog has been vomiting for 3 days and you're like, okay,
They couldn't have come
why?
in 2 days ago.
Or even why didn't you call this morning?
Yeah.
And yes, that's frustrating, but like if it's a good long-term client, can we work them in? Can we figure that out? And sometimes, I mean, I've had sometimes where I've had to say no to people because I've got to get home to pick my son up from childcare. Like that's a non-negotiable.
Right.
But then I have other days where it's like, hey, you know what? Like, yes, I can stay a little bit late and handle this. And so I think I think it's being willing, having those boundaries, but being able to be a little bit flexible. And my team knows the days that I say, hey, my son has an event, or, I'm the one who's picking him up from childcare. My husband's out of town this week. Like, they're very good at respecting that and saying, okay, like we're gonna have to say no because we've got to get you out on time. And so I think it's just about having that open, honest conversation.
Being
between
transparent.
everybody. Yeah.
And everybody, including, because a lot of times the people who are creating this havoc on your schedule aren't within the four walls of the practice.
Hmm.
Usually they're outside the four walls of the practice. So we can explain to our staff why I got to go today. And
Hmm.
yet we haven't really set up for success the conversation with our clients. So
Hmm.
if I can say I will, but you know, I have a wonderful 3-year-old who plays soccer, and I have to leave at 12 on Saturdays because of the fact that, we have soccer games at 1.
Yeah.
And I just want you to know that up front. And that's why I have such a great relationship with Dr. Smith at the emergency clinic, or if you're in a town that has one of the vets open, a month, so that everybody puts a month in of, oh shit, if there's an emergency, they don't have to go to the emergency vet, they can come to me or to someone else.
Hmm.
That's the kind of thing that works in my neck of the woods when I'm mentoring clients on how to speak to vets. Ask
Yeah.
questions, say, if I have an emergency, what happens? And
Yeah.
I find that a lot of vets say, well, we'll do the best we can to see you, and they don't add, but you know what, I have this great relationship with Dr. Boatright at the practice, and we have every other weekend that we work together. Have you seen that in creating the discussion about spectrum of care, that you give them an alternative, if you can, because sometimes you can't. I mean, here in Eastern North Carolina, we have 12 practices in a 5-mile radius, and not one of them is open on a Saturday because there's an emergency clinic in Swansboro about 30 minutes away, and an emergency clinic in Havelock about 30 minutes away. So they all just close and say, hey, go there. And
Hmm.
in when you're talking to clients and you're mentoring mentors and students, is there ever a time where you do a scenario where, how do you tell your client about this before they need it?
Yeah, I mean, I definitely do that sometimes. Like, I mean, do have some clients who like straight up ask, like, okay, what do we do when you're not here? And then I have that conversation of, okay, this, and a lot of times, like, I'm someone where I share my personal experience, and I'll tell them, like, I know that this is a hard area because there's not a lot of emergency care. And, I've had to take my own cat down to Pittsburgh, which is an hour away on a weekend, and I'm the vet. Like, it hits us too. But and I'll tell them, I'm also a big proponent of, like, if we're heading into the weekend and maybe we've done some diagnostics and we're going to try outpatient, maybe it's a pancreatitis, and some of those do fine outpatient, but I always warn people, like, some of these guys need to be
Yeah,
hospitalized
they
and they
can
could go
crash.
right, they could go downhill over the weekend. I'm a little bit superstitious, so I will send my clients with all their diagnostics, and I'm like, here, I want you to have this. My hope is that you're not going to need it
Right.
because I've given it to
Murphy's
you.
Law, if you have it, you're not going to need it.
Right. But this way you have it so you don't necessarily have to repeat all the diagnostics at the ER, because they are not going to be able to get my records
Right.
on Saturday or
Right.
Sunday. Um, and I have a good relationship with a lot of my clients, and my team is very supportive of, like, so my schedule changes from time to time because I travel for conferences. I leave early to be able to do a webinar. And I'm the doctor who works the later shift. So there are some, like, when I'm out of town, we close early. We communicate that to our clients ahead of time. And, a lot of my clients who I'm managing diseases with, like, I'll say, hey, I'm going to be out of town next week because I'm going to a conference. A lot of them, they know I have a kid. They know what I do outside of the clinic, and that I do
Transparent.
this lecturing because I've shared that with them.
Yeah.
And most of them are very supportive. They're like, that's great. We're so glad. I have kids, or I have some clients who come in, and the first thing I come in and ask how their dog is, and they're like, and how's your son?
Yeah.
And so yeah, it's about building those relationships.
Yeah, it's trust. It's know, like, and trust, right? You need to
Hmm.
know, like, and trust them. You need to know about their pets, their kids, their likes,
Hmm.
dislikes. And that helps with the discussion on spectrum of care because, the cost of veterinary medicine now is a little bit difficult for people to meet, especially in
It
these
is.
economic times. And having the ability, and I'm sure you talk about this both in mentorship discussions, how do you talk to your mentees about this? Because it's really important to have mentees have language they can use to create a better conversation, but also talking to the mentees, if the mentor doesn't, on better communication. Because
Mhm.
we know some people are really good at this and some people really stink, and they might not know they stink. So you want to create the ability for mentees and mentors to discuss that spectrum of care in a way that assists the client to feel not as if, you know, judged, but
Mhm.
rather given the information, all the information they need, including your schedule, and
Yeah.
your kids and your dogs and your cats. So we're all, on the same team.
Yeah. And I think too, like, I mean, one of the things, like, I know I sometimes drive my team crazy because I'm a talker, and I'll be in the exam room and they're like, oh my gosh, like, like you have
20
3 appointments
minutes,
waiting.
get out.
And I'm like, you know what? Yes, I have 3 appointments waiting, but they're all going to get the same amount of time from me. Um, you know, and, and for me, like, I mean, I like knowing what's going on with my clients. I think like sometimes it's good to be a little curious and nosy. Like I think that's, it's the diagnostic tool they didn't teach us.
Yeah. They just
Is,
went out on a camping trip and now the dog's having, raging diarrhea or vomit. Well, you need
yeah.
that.
Yeah. Or, going back to, I said, we get annoyed when that client calls at 5:30 and it's been going on for 3 days. But like, you know, there are, and yes, there are some people who just didn't think to call.
Yeah.
But there are some people where, yes, the dog was vomiting and they wanted to call, but they were dealing with a sick family member in the hospital, and that had to take priority first.
Yeah.
And so it's being able to step back from that judgment, and ask the question of, if they are declining a recommendation you feel strongly about, can you tell me more about, you know, about about why you're not interested in doing this. And it's having that conversation. Sometimes when I have those cases where, yeah, it's been going on for a week and now we've decided to come in, I'll ask, okay, what changed that prompted you to come in today? And sometimes it's, it was convenient. So, or sometimes they share, hey, this is everything I've had going on and I wanted to come sooner and I just couldn't.
Yeah.
And so it helps when we get that information, it helps pull us out of that judgment sometimes. And I'll be honest, I can be a very judgmental person. And it's something, I have to work on like what's going on in my head, and kind of do that check-in of like, why am I feeling this way right now? Is there a piece of information that I don't have?
I love that because when I teach, I always say, just think about what's going on for you because it's not necessarily what's going on for them.
Mm-hmm.
And yeah, if it was you, you would have done A, B, and C. And why didn't they? And what's wrong with them? And yet, like you said, you just curiously say, so what changed? So
Mm-hmm.
that you brought him in. Well, my mom was in the hospital and I had to be there, or I had to work overtime because if I didn't, I'd lose my job, or whatever it is. I didn't want to leave Fluffy for a week. Or it could be, I was hoping she'd get better and I wouldn't have to spend $200 coming
Mm-hmm.
here and having you do whatever it is you're going to do. I know there was a discussion on one of the Facebook groups that I'm in where somebody who's in the vet field said, sometimes now I think about waiting 24 hours before going to the vet when I think something's wrong because of the cost. And this is
Mm-hmm.
someone who isn't necessarily living paycheck to paycheck, but yeah, the cost of veterinary medicine has absolutely gone up. And I think the ability to understand, to have that conversation, which you talked about beautifully, uh, as to why, as to what's in it for you and the pet to do this,
Mm-hmm.
is something you've got to do. And I'm sure you do it so that when you're talking about spectrum of care, you're meeting them where they are, you're giving them the options that they have, with the caveat that there isn't just one right option. I mean, in your
Yeah.
head you might have one, but I'm sure when you present them, you present it in a way that respects that they might not be able to do the gold standards. I love that
Mm-hmm.
term. I want to like throw it in the toilet. I do. Because
Yeah. Yeah.
everybody's doing the best they can. So for
Mm-hmm.
them, the gold standard might be all they can afford is euthanasia, God forbid, but
Yeah.
it's all they can afford. I had a conversation yesterday about someone having, and this is something I'm thinking about doing a paper about, divorcing people, and one brings it in to be euthanized because it or one wanted it to be euthanized because it got hit by a car, and the other wanted to save it, and it wasn't a life-threatening injury. And the vet was like, what do I do?
Yeah.
What do I do? I mean, all of these are questions that come into stark relief when they occur.
Hmm.
But spectrum of care. So when you talk about spectrum of care, I've been a little all over the place with the spectrum of care. What do you mean? Because for me, I'll just say upfront, it's giving people the options that they can do for their pet, both in wellness and in emergency or sickness. What is it? What is it for you?
Yeah, so for me, it's that there's a range of options for almost everything. And it's our duty as veterinarians to work with the client to find the option that maximizes the pet's quality of life within the client's limitations. Sometimes that's financial, sometimes it's a physical limitation, an emotional limitation. I think we have to think, I think a lot of people come to spectrum of care from finances, but there's a lot more barriers that we can deal with that we have to learn about. And when we do it, it allows us, we meet our moral, ethical, legal obligations as veterinarians. And honestly, like what I've found is being able to, have patience and say, yes, maybe we can't do it by the book, but I can still help you. Like that's where, we talk about the well-being issues in our profession. Practicing spectrum of care is something we can all do to decrease some of that moral distress and that secondary trauma that we experience. And I really like in the UK they use contextualized care, and I love that term because that really does capture the heart of it. But at the same time, we have fought so hard over the last 7 years to get spectrum of care recognized that trying to change the terminology now in the US, I think is going to be trickier. But to me, I use those terms interchangeably
I
when I talk to people.
I love it because what you're doing is you're helping veterinarians, both young and experienced, both new, they call them baby vets, and I say that with all love and affection, but young veterinarians and older veterinarians really thrive in a new era of veterinary medicine.
Yeah, it's changing the story. And yes, I'm amazed at the scientific advances that we've had in this field, the new drugs, the new technology, the new treatments. And I am so thankful to the specialists, and I'm so thankful to all the people who pioneer those things. But, that doesn't mean that's the only path. And there's a lot of clients that that's not a path that they want to pursue. And so it's about talking to people and finding out, what are their goals, what are their values, what are their limitations and barriers, and then let's put this puzzle together with what we know about this disease process, what we know about this individual patient and this individual client, and what resources they have, what resources I have in the clinic or in my area, and then we make recommendations based on that.
Yeah, and you have to be okay with that. And I think that's where sometimes the burnout comes when you're not
Mm-hmm.
okay, or when the
Yeah.
staff isn't okay with the decisions made by um, the veterinarian along with the client. And yeah, it may not be exactly what you would have done if this was your pet, and they're doing the best they can for their pet. So being aware of that and really, as you said, I'm giving them all the information. And sometimes you'll be like, well, why don't you take the angel fund that I have and use it to do this or to do that. And we never know what
Mhm.
it is that will create that boundary to entry to the treatment. And honoring it is pretty wonderful. I'm so glad you came, Kate. I can't believe we're at 30 minutes already. This is like flying by. Where can people Well, first of all, I know that you don't mentor clients, so this might be listened to by clients as well as veterinarians. But you definitely, if people want to follow you on Facebook or on LinkedIn or on Instagram, where can they find you? And of course, all the veterinarians that listen here, I would love for you to join, Kate in what she's trying to do to help you um, be the best veterinarian you can. So where can they find you?
Yeah, so on Instagram, I'm Write the Boat, WRITE, the boat. And that's also my website, writetheboat.com. I do have an email list for veterinarian students, vet professionals. And I talk a lot at Spectrum of Care and mentorship. I have a mentorship manual to help support veterinary practices that are trying to get mentorship going. That's on my website. I do a ton of writing. So usually if you are picking up your trade magazines and flipping through, look for the name. I've slowed down a little bit early this year because I've been working on more textbooks and journal articles that are on the horizon, which is really exciting.
That is
Um,
exciting because
yeah,
actually
so
recognizing it should be in a textbook. What a concept.
yes. So I'm working on both mentorship and spectrum of care content for textbooks now. And that probably won't be out till 2026. But that's
But
on the
it's
horizon.
on the horizon, which is
Hmm.
going to make veterinary medicine and the practice of veterinary medicine so much better. And hopefully the mentorship, and if I can help you in any way about client communication, let me know, because the mentorship really needs to not only be between the veterinarians, but also between the veterinarians about matriculating with the clients, because it's really,
Hmm.
I'm
So
so
yeah, so I would say, my website and my social media are the best place to go to kind of find out what I'm up to and what I'm offering. I'm at a lot of different conferences. I'll be at Fetch Nashville, Fetch Coastal, AVMA Convention. So I hope to, see people there.
Well, I'm going to have all of this information in the show notes. So if you didn't get it while Kate was talking about it, but remember, it's write the boat, not WRIGHT. It's WRITE, the boat. Because as she said at the beginning, she does a lot of writing, so it works perfectly. I love it. Uh, Kate, thank you so much for coming on. Why do
Yeah,
Pets Matter?
absolutely.
I'm so glad you're here, and have a great season of conferences. Hopefully all your rooms will be filled. And when you do any great panels or anything, let me know so that we can showcase them here on Why Do Pets Matter, because it is really important for people to find out what you and your colleagues are doing in mentorship.
Yeah, absolutely. Well,
You all take care. Thank you all for being here. This is Deborah Hamilton. You've been listening to Why Do Pets Matter. Now go kiss your pet for me. Thanks.